We're there for a purpose. We're there to help teach them because they are children. And we should mold them, educate them as often as we can, build a rapport with the parents when it's possible. I know it's not always possible, but when it is possible, build that rapport with the parent to support them, let them know that we're all on the same team. And the focus of our relationship is to help improve the health outcomes of our students. And I say our students. They're our children. So at this time, I'm gonna bring to your front Ms. Shauna K. James to share her miraculous story with you. Please give her your full attention. Thank you.
Good morning, everyone. Good afternoon now. So bear with me. People who know me personally are very vocal, but I'm a little shy, so bear with me. My name is Shauna K. James, like she said, and today I just want to speak from a personal place about, growing up as a child with juvenile diabetes. About the complexity of managing a chronic illness in the school system, and about the nurses who helped me survive when I didn't even fully understand what I was facing on my own. My story begins in Jamaica and it continues here in the United States through illness, cultural barriers, and organ transplant. I'm a kidney pancreas recipient, transplant recipient, yes. I was born on June 2nd, 1992 in Jamaica to my parents, Geraldine Bisesa and Thomas James. Both of my parents suffered from diabetes. My father battled with type 2 diabetes along with hypertension. He had strokes, heart bypass surgery, and ultimately he had end-stage renal disease. He developed sepsis from his dialysis catheter and gave him an infection, and he passed away on February 11, 2016. My mother also continues to battle type 2 diabetes and hypertension today. So from the very beginning, diabetes wasn't just a diagnosis, it was a part of my family's reality, culture, and our story. In 2001, my mother and I migrated from Jamaica to Florida. Shortly after moving, my mother became ill at work and discovered that she was diabetic. That discovery led her to come home and test my blood sugar. And we learned that I was diabetic too. At 11 years old, I was diagnosed with juvenile type 2 diabetes, not 1, which is rare. But numbers and labels don't prepare you for living with diabetes as a child. Diabetes as a child is finger pricks between spelling tests, feeling shaky during gym class, and being rushed out of school in the back of an ambulance. Now, if I can engage the room for a bit, how many of you are diabetic yourselves or know someone who suffers from diabetes? Okay, that's a lot of you. So, growing up diabetic as a child is complicated enough. Growing up diabetic as a Black Caribbean immigrant child adds another layer. I attended Pompano Beach Middle School, and during that time, I was often sent to the hospital in the back of an ambulance. But my life changed when I got to Blanche Ely High School, because that's where I met Nurse Shelia. Now listen, Nurse Shelia and I, we haven't always had, like she said before, it was a tumultuous relationship. She annoyed me from the very beginning. From the very beginning. And she was overly and aggressively concerned, and I've grown to learn that it was out of love. And I thank her for everything that she did. So over time, she became someone I relied on. She founded a diabetes club at Blanche Ely High School, and I eventually became the president of said club. So now let's fast forward into adulthood. My type 2 diabetes progressed into end-stage renal disease. I was placed on dialysis. I was evaluated for a kidney pancreas transplant, and on March 28, 2023, I received my kidney pancreas transplant. During recovery, I experienced serious complications, including esophageal perforation, bed sores, loss of mobility, and I was in severe pain. And through all of that, the nurses cared for me. that brings me to an important truth. Nurses are not just the people who manage our conditions, they manage humanity. Now, let me go into cultural barrier and ethical challenges in healthcare access for minority populations. The barriers are real. Language differences, cultural misunderstandings, immigration status concerns, ethical limitations, mistrust in the medical system, and lack of representation, limited access to specialists, unequal distribution of school nurses, and just bias and stigma. If you're a nurse in this room, please listen carefully. You matter more than you ever know. You may think you're just doing your job, but you are changing the trajectory of people's lives. So also going back to Nurse Shelia and I in school, I went from not only being her student that she cared for, she taught me a lot of things that, I was also like misinformed about, like testing my blood sugar and certain things. She would often come to lunch and ask me, are you sure you're supposed to be eating that? One day in particular, she snatched my lunch away, threw it in the garbage and handed me a salad, and I'm like, where did you do that at? Like, I'm not eating that. Like, stop playing with me. But, she is someone who I appreciate. She not only built a rapport with me, she built a rapport with my mom. My mom didn't have to worry while she was at work about whether or not I was okay because Nurse Shelia was there. So we appreciate her for all that she does. And you can see she continues to do daily to bring education to everyone about diabetes and awareness and what to do in certain situations. So we can't thank her enough for all that she does. Okay, so usually my nephrology team, they like to joke and say that I'm the small percentage. Like for instance, like when you go and you get your eyes examined and they give you the IV to test the blood vessels in your eyes, and they give you like I forgot what it's called. They give you an intravenous injection. I can't think of it because I'm allergic to it, and I can't remember the name. The eye dye, yes, the eye dye test. Thank you so much. So, you know how they say it's okay you can get the eye dye test because only 1% of people are allergic. Well, I'm in the 1%. So they say she's our 1%. So a lot of the times even when I went for transplant workups, they were like, you're type 2 diabetic? I'm like, yes, that's what I was diagnosed. They're like, no, you're type 1. Like, you can't force me to be type 1. I'm the 1%. I'm type 2. Conversations like this matter because this condition doesn't just affect the person who has it. It affects families, schools, workplaces, and entire communities. Growing up diabetic as a child is complicated enough. Growing up as a Caribbean immigrant child as another layer. There are cultural misunderstanding, food differences, family patterns, and the quiet but powerful sense that your body has betrayed you somehow. And while the medical system sees numbers, blood sugar readings, and medication names, a child sees fear, embarrassment, and differences. Attending Pompano Middle, I used to go and sit with Miss Annie Pratt, that was my guidance counselor. She did her best with what she knew, but guidance counselors are not trained professionals. There were times where my blood sugars would drop so low I would start to tremble, sweat, get dizzy, or become confused. Sometimes my classmates didn't know whether I was sick or acting weird, and we all know kids can be very painfully honest. I was teased, stared at, and judged for something I didn't choose or could control. Diabetes medications like metformin did not help my social life either. Would send me to the toilet often, and I would also argue with my mom every day about taking the medication. I would lie to her and tell her I took it when I didn't, because it was embarrassing. So the side effects are no joke. I didn't want to take them at all. I didn't want to spend my day running to the bathroom, getting sent home. I just do anything or give anything to be a normal kid who didn't have to prick their fingers, count their carbs. Instead, I was a child that would sit in the class and eat when others couldn't, and everybody would feel like I was privileged or preferred, and they didn't understand. It didn't make me popular at all. Other kids would look at me like, why does she get snacks? Meanwhile, I'm just thinking, trade me your pancreas, you can have my Doritos. But my life changed, like I said, when I met Nurse Shelia. For all the nurses in the room, this part is the part that I love most. Nurse Shelia was annoyingly loving and aggressively concerned. She cared so much I felt like it was harassment at some times. Over time, we grew this rapport that I cherish to this day. But here's the thing, she never embarrassed me in front of others. She redirected me with care, not cruelty. She didn't just judge my choices, she educated them. She explained why carbs mattered, why blood sugar spikes matter, why long-term damage matters. She built a relationship with me where I trusted her even when she got on my nerves. Over time, she became someone I relied on. She nurtured me, advocated for me, and taught me how to advocate for myself. She also founded the club that I became the president of, and I became the girl who used to run from her nurse, and now being someone who taught others throughout the school about diabetes. That's what nurses with compassion and pride do. They don't treat that diseases, they shape lives. So now into my adulthood, being placed on dialysis, I lost weight, my body changed, my energy changed, I lost my identity in itself. And eventually I was evaluated for a kidney pancreas transplant. Getting a transplant is not just a medical journey. It is a cultural, emotional, ethical, and spiritual journey. There are barriers that are not visible on charts, on lab results. Minority patients often face mistrust of the medical system, financial hardship, lack of access to specialists, and communication barriers. When you're sick, scared, and exhausted, those barriers feel like mountains. Like I said, again, on March 28th, I received my kidney pancreas transplant of 2023. But that's not the end of my medical challenges. After surgery, I experienced serious complications, including an esophageal perforation due to negligence in the hospital. I developed bed sores, I lost the ability to ambulate for a time, I lost weight, I battled to eat, I battled to survive. During that time, I saw the full spectrum of healthcare professionals. Some were detached and cold, but many, especially the nurses, were the reason I am standing here today. This one nurse in particular, I remember I was in the ICU still, and they were getting ready to transfer me out to go home. And one of my nurses said to me, well, why don't you eat? I said, because I feel like I'm eating to die, not eating to survive. He took nothing of it. They transferred me to the 7th floor, because there's different floors before you transfer home. And I can't remember her name. It'll come to me, but I can't remember her name, but I owe this lady my life. She asked me the same question, and I said to her, because I feel like I'm eating to die, not to survive. She took it upon herself to come to work the next day, even though she told me she wasn't going to be there. She took the time to be able to get me to see my son, which I haven't seen in over a month. And the day my mom, my stepdad, my son, and my godbrother came, because she took me to do testing and all of that, she came to work when she shouldn't have, just for me. They found that I had a perforation in my esophagus. And the breakfast that she forced me to eat that morning, while they did it, they sedated me, but I wasn't all the way put to sleep, so I could hear everything that's going on. So as they're drilling into my ribs, trying to drain and take the food out, they found eggs in my lungs, coffee, whatever I had that morning. So it was rough, but this is why nurses who care and are overly concerned and aggressive, just like Nurse Shelia, are necessary. So I just want to say thank you to all the nurses in the room for all that you do.
You're awesome.
So there were nurses who monitored me when I couldn't keep my eyes open, nurses who advocated for me when I couldn't speak for myself, nurses who noticed things that surgeons and physicians overlooked, nurses who cleaned wounds, repositioned my body, adjusted tubes, comforted my mother, and treated me like a whole human being, not just a case number. That brings me to an important truth. Nurses do not just manage conditions, they manage humanity. And that will always stick with me. They translate complicated medical language into understanding. They protect patient dignity. They advocate in rooms we cannot enter. They take pride in their oaths because they know that their work affects human lives, families, and memories. Now let me tie this back into, cultural barriers and ethical challenges. Like I said before, bias and stigma is a big thing. Sometimes for people who also have a language impediment or a barrier where they can't understand. Like a lot of people can misconstrue words or things could feel a bias or feel like they feel less than or lower than. So sometimes it's good to have nurses with different backgrounds that can advocate or say no, this is what's going on when patients feel confused or just out of place. Especially when you're sick, you feel alone at times, and it's good to know that not only do you have the support of your family, but the support of your healthcare worker too. So in the school setting, minority diabetic students may suffer more because their parents work multiple jobs, they lack transportation to their appointments, they can't afford insulin or supplies, they speak different languages, they don't know how to navigate the U.S. medical system. This is where compassionate nurses become cultural bridges. They don't just treat, they connect. They connect parents to resources, they connect students to accommodations, they connect teachers to understanding, and they connect culture to care. If you're a nurse in the room, please listen to me carefully. You matter more than you will ever know. You may think you're just doing your job, but when you show up with compassion, when you take pride in your work, when you speak to students with dignity, when you advocate for a patient behind closed doors, you are changing the trajectory of people's lives even when they're too young or too sick to realize in that moment. So to close today, I just want to say, growing up with juvenile diabetes taught me what fear feels like. Surviving end-stage renal disease taught me what fragility feels like, but being cared for by nurses who showed compassion taught me what dignity feels like. And that is something a textbook cannot teach or capture. If you are a provider, a teacher, a parent, or a student listening to me this morning, I want you to remember this: advocacy saves lives. Speak up, ask questions, educate yourself, and if you're living with a chronic condition, you are not just surviving, you are learning strength that most people will never understand. To every nurse, guidance counselor, family member, and peer who has supported a child with diabetes, thank you. Thank you for showing up early, staying late, and caring with purpose. I'm alive today not just because of medicine, but because of compassionate people combined with clinical skill. I hope today reminds you that your work has meaning, your presence has power, and your pride in your oath has impact. Thank you all for listening today. God bless you all. One more thing. I wear green all the time because green is kidney transplant color. And I've always liked butterflies, but butterflies have a more significant meaning to me. The struggle of a butterfly. They struggle to survive. So that's my story. Thank you for listening.